I usually tell patients when they had a YAG capsulotomy that they do not have to have it again. I now have had 3 patients where it needed to be repeated.
Why did it need to be repeated?
So one patient, it recurred after years. Another patient recurred within a few months. And this patient had had a cataract surgery 10 years ago over, and then had a YAG capsulotomy shortly after. And she noticed still over the last few years, the vision had decreased again.
But I would think if you do a YAG, you're going to blow out the back of the capsule, and PCO, these cells need some scaffolding to grow on. So when we say it's a recurrent PCO, is it making its own new scaffolding and going all the way to the central visual axis, or just peripheral?
It can. So
problems?
it can. This YAG, as you can see, I just do in the periphery because it needs to be larger. But the lens epithelium can also grow directly on the lens. So it's technically not a recurrent posterior capsular opacification, but a posterior opacification behind the lens. And the lens epithelium, when it grows on the lens, you will treat similarly with using a YAG to remove it and push it into the vitreous.
I guess my question also is, how are these cells actually proliferating? So we have cells that are inside of the capsule. Most of them were removed at the time of surgery, but you still have cells that are actively proliferating, or why is this happening?
There's always lenses that are proliferating because they usually start just in a normal lens, also at the equator, and then grow across and elongate. There's also, in kids, for example, they always get a vitrectomy because if they just do a posterior capsulorhexis and capsulotomy, the cells can grow over the anterior hyaloid and use that as a scaffold. And I've had that now in some of my cases. I've started doing a posterior capsulorhexis, but I had another 2 patients where the anterior hyaloid, even an adult, opacified and had to do a YAG to remove this. Any patient where we do a YAG, usually both the posterior capsule and the anterior hyaloid is treated.
So those cells are just looking for any potential space to slide across, like you mentioned, vitreous, most of the time capsule, and in this case we're suspecting it's on the actual lens then, where it's moving across.
And it still can be treated with a YAG, so recurrence is a fair term because it's treated in the same way.
Got it.